We are live. This is Just Be Well, the channel about whole life wellness. I'm Tom.sult, a medical doctor and functional medicine practitioner.
I'm Elizabeth, a registered nurse and whole life coach.
And today we're talking about stealth pathology. We're talking about how bugs, infections, how bacteria, viruses, fungus, and everything in between evade the immune system and what you can do about it. So this is really a problem with, originally the long-standing problem is with tuberculosis. All doctors understand that tuberculosis requires 6 months, a year, 18 months of treatment depending on the details, and sometimes it requires recurrent bouts of treatment. And it's now been shown that this is true for certain kinds of mycobacterium, and it appears to be true for many viruses. There are certain viruses that can simply live in you from the time you're infected in early to mid or late teens throughout the rest of your life. And then more recently, there's evidence to suggest that Lyme disease is one of these kinds of infections. So stealth pathology of many different kinds. And we now believe, we've known with certainty for years that certain kinds of animal cancers are the result of infections. Feline leukemia as an example. And so this applies potentially in the future to cancers and things like that. So, but we're going to talk, I think, primarily about Lyme disease because that's kind of what most of our listeners and most of our patients are suffering with and dealing with. And it's really hard for people to understand this idea that, well, when I have the strep throat, I just take 10 days of antibiotics and I'm better. What's going on? You must not be using the right antibiotic. And that's just not the case, and we'll explain why. So going back to Lyme disease, you just took one course of antibiotics and boom, we're better, right?
I actually never took antibiotics.
Ah, how come?
I just couldn't, even when I would have, say, strep throat, when I took a dose of antibiotics, I knew that it was going to take me a long time before I could get back to my normal gut function. So I've always had a sensitivity to multiple prescription drugs, one of them being antibiotics. So for me, once I found out I had Lyme disease, I really was open to looking at other options, and in fact, there are other options that have been found to be more effective than triple antibiotic therapy. So why wouldn't I try something that's gentler on my system?
I thought that the only way to cure an infection was with an antibiotic.
Well, there are many forms of natural antimicrobials or antibiotics.
And presumably we have this unbelievably robust internal defense system as well.
Right. Most germs don't make us sick. They're actually beneficial to us. It's just a small number of them that can cause illness, and especially once you get down to those imbalances, they're more likely to cause illness because they flourish more and then the good ones are less. So it's really about bringing those back into the right balance. And
exactly.
Yeah.
So I just left camera to try to turn off the fan on this thing because I realized it's roaring in the background and I'm about to catch on fire.
I turn it off too.
Yeah, maybe I could just turn it off. Maybe that's the thing to do. Here we go. There. But the issue here is how, part of what we're going to talk about, how do you increase your innate immune response? Right? Really, the original diagnostician, the original therapeutic tool that we all are born with is our immune system. So how can we optimize that? But also, what is going on with these bugs that they are able to evade? So You know, biofilms. Biofilms are one of the ways in which bugs can evade the immune system. And I like to think of biofilms as fruit cocktail jello. Fruit cocktail jello, think of it this way, the jello is the biofilm, and each different kind of fruit in the fruit cocktail jello is a different bacteria, a different species of bacteria. For those of you who aren't from the Midwest maybe and don't know what fruit cocktail jello is, you buy a can of fruit cocktail, which has got those really pale grapes that look like they've been soaking way too long, and all of the sort of gray fruit, right? And you pour that into the jello and mix it around and then let it solidify. So that's fruit cocktail jello. And so you've got one bacteria in this bug, maybe, that can make penicillinase. And it can elaborate a cloud of penicillinase out into this biofilm. Now, let's say it's the pineapples. The pineapples can make penicillinase. Penicillinase is the enzyme that bacteria can make that make them resistant to penicillin. So it's elaborating this cloud of penicillinase into the biofilm so that all of the bacteria, whether they can make this stuff or not, are somewhat protected from any penicillin-like bacterium. And there are many other factors that they can elaborate. They can change the pH of the biofilm, they can change the structure of the biofilm, and so on and so forth. So biofilms are one way in which the bugs can evade. They make the jello thicker, so the antibiotics and the antibodies can't sneak through. And we've known about these for a long time. In residency, when somebody has a systemic, whole body infection, and we have lines in them, we put a line under their clavicle, into their heart to monitor their blood pressure and whatever, or their heart pressures. Sometimes when you pull that thing out, there's a long, slimy, stringy thing hanging off the end of it. That's a biofilm. And that is the way in which bacteria can hide from the immune system and flourish. And so, people think, well, let's just eradicate all the biofilms. Well, your probiotic, healthy bacteria are in biofilms also. So you really don't want to just wholesale eliminate everything. It's about balance. We would like to create an environment that favors probiotic biofilms and deters pathogenic biofilms. So one natural substance that can do that is colostrum. So I don't know, did you ever use colostrum on your journey with your Lyme?
I did. It was one of the things that I used in my morning shake.
Yeah, and what did you think about that? Was that awful, terrible, yucky tasting stuff? Or?
I didn't notice it being terrible tasting. Of course, right away, I could tell it was doing something because I was having a lot of symptoms when I started taking it. But then over time, those symptoms got less and less and less. And then really, I couldn't tell I was taking it. But once I mixed it with my other things, I never really noticed a taste, I guess. I enjoy my morning shake.
So colostrum, colostrum is made, in the case of the stuff that we take as a supplement, is made by cows generally. And it is first mother's milk. It is filled with antibodies, right? And immune support factors like lactoferrin and lactoperoxide and all these things. And basically, you're flooding your system. Remember that 70% of your immune system lines your gut. So you take the colostrum, it floods your gut with these antibodies and with immune support. There are actually studies that suggest that taking colostrum works as well as taking a flu shot. Now, I'm not advocating not taking a flu shot. I'm just saying that I do both. Other people I know do one or the other. I do both. So we know that there are benefits to taking this colostrum. Horses and deer and cattle often hang out together. And if the bacteria that bother deer, i.e. the Lyme bug, Borrelia burgdorferi, and its cousins and friends, if it is on the deer in the pasture with the cows, it's kind of a good chance that the cows are being bitten by those same bugs and likely have some antibodies against those dudes. So taking this may actually confer some specific antibodies, but that's not really the most important thing. The most important thing is it has these anti-biofilm properties. So it doesn't destroy the biofilms, it makes them more porous so that your antibodies and antibiotics can get into the biofilm to treat these bugs.
And really, I mean, you were saying how healthy bacteria have biofilms too, but
Yep.
this is very selective to
Yes.
just those harmful bacteria. So, you know, the bacteria that you need in your body aren't being harmed by taking the...
Right, the cows have similar biofilms that we have. So the cows don't generally make bacteria against their own probiotic species. And so that means that because we have similar bacteria, they're not really making antibodies against our probiotic species either. So basically, we're tamping down the bad guys without bothering the good guys. So the good guys can flourish and the bad guys get tampered down.
Yeah.
And unlike taking an herbal antibiotic or a prescription antibiotic where it might break down both. So that's a big reason why I love to use colostrum-like products. Another way in which bacteria can evade the immune system is through going dormant. They can actually, in the case of Lyme, it can do several things. It's a spirochete. It looks like a corkscrew. But to be in that shape of a corkscrew requires a cell wall. So it can just, and many antibiotics work on the cell wall. So it can just shed its cell wall and become a cell wall deficient form, which turns in from that spiral, it turns into just a sphere, basically. And they're called cell wall deficient forms, or they're called L forms. I don't know where the L came from. I'm sure I could look it up, but I didn't. So anyway, because they don't have a cell wall, any cell wall active antibiotic won't kill them. So that's one thing they can do in their defense. As soon as they notice this threat that their cell wall is being attacked, they just shed it, become an L form. Now, if you find a bacteria or an antibiotic that works in a different mechanism, the bug can actually become what's called a cyst, which is sort of just like if you think of a raisin is a cell wall deficient form, then, I mean, a grape is a cell wall deficient form. A raisin is a cyst. It's not like an acne cyst. It's more like, think of it like a spore. It's a little tiny thing. And that thing is essentially metabolically inactive. Now, when it's metabolically inactive, there's basically no antibiotic that's really going to kill it because it's not doing anything. There are a few that have been postulated to be able to kill the inactive forms, but let's just assume for a minute that they don't work that good because it doesn't seem like they do. So once this thing is in an inactive form, it can do something called quorum sensing. And quorum sensing is also called auto-resuscitation. So what that means is each one of these little things is letting out this little tiny bit of a signaling molecule. So you got two of them, and there's not enough concentration for it to mean anything. Then you got 4, 6, 8, 2,947, whatever the number is, and suddenly there's enough of this quorum sensing hormone being elaborated in tiny, tiny amounts by each of these cells that suddenly they all say, oh, time to wake up, and they start multiplying again. And they only do that when the immune system has sort of forgotten about their presence, right? The immune system's distracted over here doing this or not thinking about it, and it just forgets thinking about the infection. They start to slowly come out of hiding, and then the quorum sensing molecules get in higher and higher concentrations, and suddenly they all bloom. And many of you have probably experienced that, where you take antibiotics for a while and you feel great, and then you stop the antibiotics and you still feel great for maybe a few weeks, and then suddenly, bang, you're sick again. And why is that? It's because they're blooming again. So that's these various stages of changing from, creepy crawly thing to butterfly, right? So we think of it as, how strange is that? But it's kind of like a butterfly. It changes from a spirochete to a cell wall division form to this cyst form. So there are many ways that these things can evade. They can also do what other bacteria do, which is simply acquire genes from other species. So I like to say that these bugs, all of these bacteria, they're promiscuous, right? They can exchange genetic material. One bug that can make an antibiotic resistance gene can actually give it to a completely different species. And it's been shown now that Borrelia burgdorferi and its cousins and friends can accept these antibiotic resistance genes from other species, so they can actually become genetically resistant to antibiotics as well. So we've learned a lot about antibiotic resistant forms from tuberculosis and from leprosy and from other chronic kinds of infections, and we can apply those things to Lyme disease. So typically we treat people with Lyme disease like we treat somebody with tuberculosis. In other words, we use multiple approaches. If we try to surround the bug from multiple places, right, all the way around, it's harder for it to escape. So we use several different antimicrobials, we use anti-biofilm approaches, and then we cycle things. Typically, the way I do it is 6 weeks of therapy followed by a 2-week complete antimicrobial rest. And what we found by doing that is that it's much easier to kill the bugs in what's called exponential growth phase than it is in steady state phase. So we can actually synchronize their growth. We give 6 weeks of antibiotics, which is a full kill cycle. We stop, and then those guys look around, they raise their heads up, and they say, coast is clear, let's grow again. When they're in exponential growth phase, we hit them hard again for 6 weeks. That kills them, bats them down. And the more times we do that, the fewer of these persister forms seem to remain, and the more the immune system tends to get involved, because as you kill these things off, you're breaking them up, they're dying, the immune system is cleaning up the aftermath, and the immune system starts to learn and starts to become more and more aware that, hey, there's something wrong here and I need to be paying attention. So typically it takes a good 4 to 6 of these cycles to really get the upper hand. So, do the math. 6 weeks on, 2 weeks off times 4 to 6. That's a long time, right? So, yep. So it takes time. And then there are setbacks. People get sick and they can't take the treatment. So that sets us back, and now we're sort of restarting again and so on. And so the trick here is support the person while trying to kill the bugs. It's not all about killing the bugs. It's about supporting the person while we're trying to kill the bugs. So those are some of the stealthy ways that we do things, or the stealthy ways the bugs do things, and some of the things we do to counteract that. So I don't know, you have any ideas from a coaching perspective, some of your patients that maybe have struggled with the 6 weeks on, 2 weeks off, or often they get it mixed up and do it 6 weeks off and 2 weeks on?
Yeah, I call myself kind of an underwhelmer. So all this can be overwhelming, because it's like, okay, there's all these different forms and this thing is super tricky, and so we kind of take away the why of it, because the why is Dr. Salt's job. So he's thinking about, okay, and you're more about the what. So like, what's going on in my symptoms? And basically you just kind of clock out your symptoms, because everybody's a little bit different with their cycles and what's going on. So you're basically just reporting how you feel and really trying to find the regimen or the balance of the regimen that you can handle, because maybe you can't take the full dose of the colostrum. So we start you off on a half dose, and then after a week or two we increase it by a quarter dose, and then within a month you're up to the full dose. So basically your job as the patient, hi Fran, is just to report back how you're feeling, and then, you know, we give you the feedback to kind of how to balance out your life so you can move forward with the most comfort possible, with the least side effects.
Right. So, you know, people want to know about the details. I'm telling you the details, but then it freaks them out, the details. So it's her job to calm everybody down.
Yeah.
And, you know, there are a lot of details, and that's what I do, right? I went to school for a long time to understand the basic science, and then I dove into understanding these bugs in a lot
for
of
30
detail.
years. So that's a lot of knowledge. We're not going to get there, but, you know, we definitely have our part in it. And
Yeah, and so the question at every visit is always, are you better? Are you worse? Are you the same?
And we do really try to simplify it and keep it that simple.
Right. And then, you know, the answer to, well, I'm worse. Okay. In what way are you worse? How are you worse? What symptoms are worse? And often when people say I'm worse, it's like, well, this is actually way better, but this is way worse. Okay. Well, now we're getting specific, and now that gives me clues about what's going on. And then I take all of this background noise, you know, all the stealth pathology and all the different options for therapy, and we apply it to what's actually happening with you. And then we do that in the context, we've been talking all along, that it's treating you and raising your level of wellness while we're simultaneously killing off bugs, right? So we are also looking at specific labs surrounding your wellness, right? So what does your organic acid profile look like? What does your nutritional profile look like? What does your toxic stuff look like? How is your detoxification pathway working? And I'm looking at all that stuff, and I'm saying, well, we're going to change from these supplements to this supplement, or we're going to continue these but add this one, and then we're going to change up the way we do your anti-Lyme stuff as well. And it's all, you know, people want a protocol. What's your protocol? Well, I published that a couple weeks ago with the caveat that it depends. Right? It depends on you as an individual and how you're responding.
And what all these profiles look like.
Right.
You know, depending on your deficiencies or maybe extra things that you have that you need to deal with, like toxic metals. What?
We're just shifting this way slowly, it feels like.
Oh.
Anyway, so I'm sorry, go ahead.
No, it's gone. With me, I mean, once you interrupt my train of thought, it's like
gone.
It floated away. But anyway.
So you were talking about it. It's all about what, you know, what's going on with you. And so, you know, from a coaching perspective, a patient comes in and we're going to implement a new set of supplements. Do you find that people get attached to their supplements and find it very difficult to let this one go, and so that we can start this new one?
I find that sometimes you almost look too deeply at the supplements. And that can be kind of, that can get to be confusing, I think, when you're looking so deeply at each supplement fixing this certain thing, where the supplement is there to support you, but it's not the thing fixing it. So, you know, it's almost just about changing the perspective. I'm more of a perspective mindset coach than anything.
And I think that's critical. I like to say Voltaire said, the art of medicine is entertaining the patient while nature cures the disease. And where does that put me as a physician, right? Just sort of as a puppeteer, I suppose. But really, you know, don't focus on this one thing. This one thing, if it was going to fix it, it would have already fixed it. It's the totality of it. It's your mindset, probably most important. And then it's these little supplements that are supporting this biochemistry in general. Not this one thing is doing this exact thing. You know, if you think about the physiology is huge, uncomprehendable. If you put a little thing in here, you can't say that this exact thing's going to happen in here, because it's a maze and all this stuff's happening. And it may come out over here or down here, over there. But we can assume that if we give you all the right things, we can raise your level of wellness to the point where disease can't flourish. So we're trying to raise your level of wellness at the same time beat down the degree of bug. And then hopefully at some point when the scales flip, then the wellness can finish the job. And that's really the idea of functional medicine. And so getting too involved in all these details, people want to know them, but I want you to understand you don't need a PhD in stealth pathology. You just need to know how you feel. And sometimes that's really hard to figure out. How do I feel? I've been sick so long, I don't know what good feels like.
Yeah, and sometimes you lose track of, well, when did it really start? That's why usually when you ask me about mine, I have to really think, because it's almost like a cloud. And, there's a fog in there that I can't quite remember.
Yeah, and so I often ask, when is the last time you were truly well? And they say, wow, no one's ever asked me that before. I don't know. Well, we got to explore that. Let's find out. And then the other thing is, what do you do that makes you happy? And often people don't have an answer to that question. That doesn't do good things to your brain, which doesn't do good things to your hypothalamus, which doesn't do good things to your limbic system, which doesn't do good things to your thyroid and adrenals and fight or flight and autonomic nervous system and immune system. So it's not just the pills. It's the whole life intervention.
Yeah, it's really about balance. It really comes down to balance. I think everything comes down to balance. Your gut comes down to balance. Your immune system comes down to balance.
All things in moderation, including moderation, because sometimes you need to cut loose.
Yeah.
All right. How have we, I think we've covered this. If you have questions, please leave them in the comments. We'd love to address your questions. And we are going to be putting on a Lyme disease live Q&A on a Zoom call. So that will be coming next month. And we'll figure out the time and dates and start talking that up as time goes on. Don't forget, we do have a virtual clinic if you're struggling with Lyme or other symptoms. We do tertiary care functional medicine, I call it, where we see the sickest of the sick in terms of functional medicine. We also do peer-to-peer, doctor-to-doctor consults for difficult cases. And you can find that on our website at justbewell.info. So until next time, we'll see you next Thursday at 11 a.m. Central Time. Talk to you then.
Bye.
Bye.